questions, you participate. I don't see any one of you falling asleep.
Let me tell you something. In the other class, nobody listened.
It's like, you understand? And we used to just be like, cricket. Like, hold on. We don't know what the fuck going on.
Yeah. Well, remember, one of the things that I can tell you is that I work here. I work as a medical assistant. I did all these things, cultures all the time. I did many things here. I know how the system works here. But some people come from other countries, but they need a job. And because you're a doctor, then they got the opportunity to work as teachers. That they can do, because they cannot work seeing patients. So then, this is the opportunity for them. But one of the things that some of us don't do is like, educate yourself, put yourself up to date. Take some courses. Don't get satisfied. Oh, I'm a doctor.
He was talking about slapping people after
No,
I said,
you don't do that
supposed to
either.
do it.
You don't do that. As soon as you do this, you hemolyze
That's old
the
school.
blood. And that is not only, that was the way that used to be. Back in the days, they slap you, or after you drawn the blood, what is it that you ask the patient to do? Bend. You don't bend your elbow. You don't, because you're going to hemolyze the blood. And all are questions for your exam. See? All the things that is technique is what you should not do, because that is going to cause the patient to develop something, a hematoma, or the blood results to be inaccurate. And we don't want either or. You don't want your patient to come back 3 days later, 1 week later, look what you did, because that's the first thing that they tell you. Yeah, they blame you. And I'm seeing some of you going through the same situation, that they get bruised, they left a hematoma there, and then you go say, look what you did. Isn't it? Because that's what we do. And what do you think they're going to do to you? The same. But when we don't follow the proper techniques, that's exactly what's going to happen. Eventually, you're going to have patients have problems with coagulation. And they're going to bruise no matter what. It doesn't matter how gentle you were, how nice you were, how good techniques you have, because they're going to bruise. They're going to bruise. So that's why you need to learn a little more about your patients. Check the medical records. What medications are they taking? Are they have blood thinners? Do they have any other conditions? So then when they tell you something, you're not going to be rude to them. I said, yeah, you know what? Anytime that I'm taking some medications, and don't tell them, oh, well, what do you expect? You're taking this medication, that's what you get there. You're the problem. No, you don't say that. You said, oh, well, it happens to me the same. When I go to the doctor, and they always give me a risk because I'm taking some medications, and some medications cause me that for that. Don't say sorry because they think that you did it, and then, well, don't do it again. Because when you say sorry, it means you're accepting that you make a mistake, right? So never say sorry, even though if you feel like something went wrong. But this is not stepping on somebody else's shoes or toes in the train. This is in your medical field. In the medical field, people use anything that you say against you. So don't say, I'm sorry. Say, oops, what's going on? Don't say, oh, I'm sorry. No sorries. Stop, don't move. That's because you move, but don't tell them. So, once again, when you start being nice to the patient since they get there, wow, beautiful necklace. Oh, shit, I don't care. You tell them something that they want to hear, remember. Talk about little things here and there. They get distracted. They feel like they belong there, that you're welcoming them. Act.
That's why I like
I have an Oscar in acting. I just kidding.
That's why I like my tattoo.
Yeah.
It's usually like a conversation. Like every time I have a patient, they ask me, what if you get a face tattoo? And then we start talking.
Just get nothing kind of sensitive, but anything else, who cares? This patient comes here and then gone. Okay, so that will be the gray tube, remember. And this contains fluoride. That is the chemical inside, or potassium oxalate.
Oxalate.
This has two additives, fluoride and potassium oxalate. We're getting you started, believe me. Because this is very important, because we're going to have few days to do the blood. But this, if you don't know it, you're going to be struggling.
Potassium what?
Potassium oxalate.
I gotta print out one, okay? Because I think we don't got color up there. It's only black and white.
Here.
You don't know how proud I was yesterday to show my boyfriend this?
Yeah?
I was, and I was explaining everything.
It feels good, right?
Yeah.
I was trying to look for the cute.
Because he one of those people, like, even though he don't know what's going on, he still asks a lot of questions. So it felt good that I was able to answer, like, almost all the questions.
Yeah, it's like you're not totally clueless, you know.
Yeah.
So you see something, say, oh, listen, this is the big way, this is,
Maybe if we have
and they go
a-
like, they give you a test or the colors of the tubes, and then they said which one you were gonna collect first. If right here I put blood cultures, this will be collected first.
Yeah.
Which one will be collected second?
Like blue.
Which one will be third?
And then CBD.
Correct.
I mean, that's me. My bad.
No, no, no
CBC.
No worries. So that's how it works. So, which of these tubes contain serum?
The PT. The MBE.
Which number? Which number?
3.
3. This is serum because this is the red or the gold. Everything else is plasma, plasma, plasma. So knowing these 3 tubes, you see how easy it is? Knowing these 3 tubes, red, this is red also, just combined in the gold. That's it, this is serum. Everything else is plasma. These tubes, we do not spin them.
I'm scared.
It's not. Everything else we spin it. This, you do not.
What's in there right now?
This,
Yeah.
the chemical inside, SSP. And it's a lot. Oh, one more thing. If you look right here, there is a line right here. Each tube, you have to collect 10 milliliters of blood. It's not to fill it up, no. If you put too much blood, this is not gonna work because it's too much blood with ratio to the chemical. So here, you have a little line right here where you have to stop. You put blood from here to here.
So what's the
What-
difference in inverting and spinning?
Spinning is a machine that you put them to spin for 10-15 minutes so you can separate the solids from the liquids.
Can we
So-
do that?
Of course.
But the doctor would tell us.
No. Usually the laboratory tell you which tubes you need to send. Remember, anything that is plasma and you're gonna send it to an outside laboratory, you not spin it.
Anything that-
The only ones that you spin are the ones that has this glue, remember, because this separates, that's what's called tube separation tube. Anything else, you send it as the same way as you collect them.
So, but all of them you invert it.
All of them, yes, you have to invert because they have chemicals.
Okay.
We're gonna spin then, we're gonna learn here how to use the centrifuge, how to balance it, because you have to balance the tubes. You can't just put the tubes anywhere on the little slats that they have. No, I'm gonna show you how to do everything because this not only is important for you when you spin them, because otherwise you're gonna have problems after and questions for your exam. So when you do it, it's kind of things comes back to you very easily. I said, oh, I did this, so it's gotta be this. So that's basically what's going on with these tubes, okay? Any questions about these tubes? These tubes depends on the manufacturer. See, some of them comes with a little round, white round. Some of them comes with the black, and so on and so forth. But what really matters is the color right here. So that's basically what it is. Remember that these are 2 tubes. One has oxygen, the other one doesn't have oxygen. Has to be collected from different arms or different veins. You should not be collecting both from the same place because if I collect it from here, you don't want to contaminate that. Let's check the other side. So that's basically how we are gonna be moving along. And in general, for your exams, for practice, inverted tubes 5 to 8 times. 5 to 8 times. You have to have the 8 there. Is that understood? So for you, it's not 3 to 2. It's not. Here they put all these values. No worries about, because that depends on which laboratory are you working with. If you're working with Quest is going to give you certain directions. If you work with BioReference, it's going to give you a little. The changes are minimal, but you will know because you're working with that particular company and you have that application and you look at it. When there is a very specific test, the doctor is going to walk you through. They're not going to just throw in there and say no, because these tests, number one, when they are specific, they are very expensive. So when you send them to the laboratory, they're going to charge you a lot of money. How much money do you think that they charge just the same for chemistry?
1,000?
No.
500?
No, it's
$50.
$200.
For one tube?
For one tube. But if you send something that is special test, like paternity test, they're going to charge you thousands. And if you collect it wrong, you have to call the patient again and pay it again. It's not like, oh, you collected wrong, oh no, for the same price. You have a refund. No, there's no refund. So you're going to pay for it, and the doctor is not going to like it. I told one of my students, I said, listen, if you don't follow this right, and I'm going to send you to a place over there so you can do the internship. If you do it wrong, guess what? They're going to remove the money from your salary. And she was like, have to pay attention stuff. Okay, so you know the needles already, so I don't have to tell you the needles. So, what needle gauge is this one? What's the gauge of this?
Oh, that's waterfront.
The gauge.
No, so it's butterfly 16. No? 18? The bigger the long, the smaller.
What is the gauge of this one?
We wrote it down a couple days ago. Isn't that the same thing?
Very, no, it's not the same. What color is this? What color is this? AC. We have two gauges.
You really have all this stuff. Yeah. You have balls with it.
We have two major gauges that we're gonna use for our patients. One that is smaller than the other. So the main ones we're gonna be 21 3/4 gauge, 23 3/4 gauge. Now, forget about the 3/4. 21 and 23. Which one of these is larger? Thicker.
21.
Sure?
23.
What did you guys change?
I feel like 21 because I'm going off of my ears. My ears is the
See,
the
that's
smooth
exactly
number.
what you're gonna do when you check the questions on your exam. Oh, is it 21? Is it 23? Oh, no. Somebody says 23. Let's go for 23. This is the thickest one. This is thinner. Gauge means how thick the needle is. Numbers, the larger the number, the smaller or the thinner the needle. Always think about, it's the opposite. If I have 31 gauge, which one is the thickest? Don't go for 31. This is very little. This is the one that we use to apply things in the
So the
face.
smaller
The larger the number, the smaller the gauge. The gauge is how thick the needle is. So, usually for my students, because I don't want them to get confused, there are many gauges for needles. We're going to focus on these two. Why? Because these are the only ones that they're going to be asked on your exam. And usually these are the only ones that you're going to use with your patients. So you come here and you look my veins. Can you see my veins? Huge, right? Which needle would you use?
The 21.
21. If I ask you, oh no, the needle is too big, use the small one, would you do it?
No.
Why not?
Because your veins is thick.
What happened
It
if
will
you
push
use a
out.
small one?
I don't know how to explain it. Oh, sorry.
Listen, if I have a large vein, right?
I thought it was like
And you use a very tiny needle,
it could leak out.
it's too much blood trying to pass for this narrow space. What happened to those cells? They're gonna be low, they burst. Let's say that all of us try to run and pass through that door at the same time. What's gonna happen? Somebody's gonna get hurt, particularly me. They're gonna call. Gonna stop. So it is very narrow for so much blood. So independently, whether the patient tell you, the patient don't know the size of the needles, so don't tell them. They're gonna say, I want butterfly versus straight needles. That's for sure.
They never gave me that option.
Look,
They never gave me an option when I go to the doctor. They
Hold
just
on.
No, yeah, they don't give you options. But nowadays, the patients are used to butterfly, so they're gonna ask. It's not that the technician is gonna tell you, okay, do you want a big needle or a small needle? What do you think you're gonna say? Do you want butterfly or the, what is that? I don't know. They don't know. They just put their arm right there and they just waiting for the, that's what they do. But now the patients, because of the internet and because so many sources, they learn stuff. And they come to you and they ask for butterfly. They said, oh, I want the nice little needle. They don't even know that it's a butterfly. They're not going to tell you names. But they said, I want the very small needle, okay? So when they said small needle, they're talking about butterfly. Okay? Oh, you want the blue one? Okay, no, nothing like that. And this is how you're going to recognize these needles. That's what I show you the colors. Do you think that I'm going to be seeing what it says 21, 20? I'm not going to. Oh, when you see the needle, it's so small. How are you going to look at the
hole.
So you open them up and you said, okay. And the length, remember that these needles is not about how long they are. They are the same length. The thickness, how thick they are, and that's the green one. And here it says 21 3/4. But we call it only 20, 21. The other one, 23. That's it. And we know because one is blue, the other one is green. And we talk about the wings. And we open this. This is sterile. As soon as you open this, you're supposed to use it. If you don't use it, that's it. You cannot. If you just open it up and leave it there, this needle, you cannot be used later on. So if you're gonna use it, then you open it up. Other than that, you don't. Yes.
I have a question. As a medical assistant, do we also administer flu vaccines? Like, you know how that you gotta get a shot right here?
All depends. Yes. The answer is yes. Medical assistants here in New York, they are allowed to give vaccines. But this is the key. If the medical doctor wants to give vaccines most of the time, now forget about the COVID, right? But let's say you want to work in the pediatric department. They have a nurse.
Oh, okay.
They have a nurse to draw in blood. They have a nurse to do the what's called the dermal puncture. Yeah, because they do the little heel or the heel puncture of the little babies, the newborns, and they're not gonna take chances with it. So usually they have a pediatrician nurse and they do this because it's a risk. Remember, in this country, for every little detail that you do, even though if it's not your fault, they're gonna accuse you. They're gonna sue you. And if they have someone who actually have more knowledge and things like that, well, it's gonna be a little harsh to get them. So that's basically what it is. So whenever you look for those needles, you're gonna do this. I'm gonna show you tricks how to know that whenever you're drawing blood, remember, if you're drawing blood from a patient from the arm, what is the angle of the needle? 15 to 30 degrees, right? In the arm. No, 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 no. Probably you have it right, but that's in the hand. In the
It
hand.
said 15 or 30.
In the hand, you're gonna use 10 to 15. Why? Because these blood vessels are very superficial. These are larger and deeper. So for that reason, the angle is different. Another thing, when you're using the hand to draw the blood, never use 21. Always use 23 gauge because the veins are very small. Because the key and the rule of thumb for doing this, which one you should use? Large veins. Small veins. If your patient has small veins, 23. The patient has large veins, 21. Period. So who has small veins? Who else?
Old people.
And elderly. Elderly people. What is another name for elderly?
Senior.
Yes. Another one mostly used in medicine.
What is it called? What's the first
Geriatric
Oh, yeah.
patients.
When I think of geriatric, I don't know why I think about the stomach surgery.
Oh, no, no.
This
This is bariatric surgery.
I think
That's
about stomach
bariatric
surgery, so it don't connect
Tell
to
me.
me.
No, I thought the same thing. That's what I thought.
So, and those are the questions that you're gonna see. Because they give you a little scenario, right?
Geriatric.
You are the phlebotomist and you have a geriatric patient. Immediately, as soon as you hear the word geriatric, you know your eyes should be 23 needle. Because they're gonna ask you just that. Because you are taking the phlebotomy test. Remember, when you're taking the phlebotomy test or the anatomy test, focus on the subject. Don't draw yourself away from, because it might be, oh wow, but in this you do this. No, but we're talking about this. So don't mix things up because then you're gonna problem. So this is the way. Okay, so one of the things that you have to do when you are going to introduce the needle is, then it has something, a little piece at the end that is called the bevel, right?
Yeah.
The bevel should be facing up or down? Up, always, always. Because the bevel is like the little kind of cut that you have like indented, and you go like this and the blood goes. And if it goes like this, what blood's gonna go? Because you have to enter the blood through the gauge of the needle. So that's basically what it is. So for these needles, that's what I want you to do. Get used to butterfly for you. Don't think much about the patient because these are very safe. With the stray needles, if you don't have a good practice on that, I bet you will pop yourself. Most of the people that injure themselves is because they use stray needles. Is that understood? Because stray needles, you have to be very careful, very cautious when you drawing blood, because it's stray needle, that's what it's called. You just connect this needle right there to this and to the vein. The other one has a little cord, a little tube.
That's like.
These ones, you don't know whether you are inside the vein or not. The only time that you're gonna figure it out is when you put the tube and blood starts seeping in. With this one, you know, without putting the tube, if you are inside the vein. And it's safer for you. Remember, when you introduce this needle, you don't have to hold the butterfly. You don't. Release the butterfly right there and start manipulating into your tubes and putting your tubes in and out. Because that's what this is all about, because it has the advantage of that little tube that, you know, it's gonna separate it and you don't have to be holding it directly. But for exam purposes, they're gonna ask you, what are these wings for? To hold, not only to guide it, to hold the needle. So according to the test, you have to hold these with from the wings. So the wings, you have to hold it there. But it's mostly to guide it and to introduce it. Because here it has a little chamber at the beginning of the tube. When you see the backflow of blood, as soon as you enter, it says, ah, got it. And that's how far you're gonna introduce the needle. When you see the flash of blood entering right here, this little chamber, don't advance the needle any farther, because you might go through the vein and you lose it. That's why whenever you're drawing blood and you see the blood and you advance it a little bit, you put the tubes, but no blood comes out, you went too far. So pull the needle slightly back, slightly. Not going back and forth, and well, all depends. Because sometimes patients are so difficult to get in. This is the only vein, and now that you're there, just when you're gonna fetch, try to make sure that you manipulate very slowly, and you pull it back a little bit, and then direct it to the side that you might think that the vein moves or is. But don't go back and forth, inside, up, and no. Because that causes pain to the patient, and most definitely the patient is going to develop a bruise or hematoma. Remember, one of the most common side effects of drawing blood is a hematoma. Remember, that's more important. Okay, I saw some of the videos that you showed me and the way that you apply the tourniquet. Okay, so we have different tourniquets. Remember, tourniquets are made of different